Hi, anatomy students. I am going to give you yet another short, I hope, overview of the autonomic nervous system. Now, for this first part here, I am actually going to go through the drawings in one of the supplemental packets that I posted for you in Canvas, and this is one titled The Autonomic Nervous System. I'm using this one instead of going through our lecture PowerPoint from the textbook again because I find this this document to be very succinct and has a lot of good examples with directions on how to get through the examples. So I'm going to do this pretty quickly, and I will point out where you can find, excuse me, I'm still recovering from my strep throat, where you can find some of these items. So first of all, we know how the nervous system at this point is organized, or at least I hope you know. I also hope that you know already at this point that when we're talking about nerves are a collection of axons outside of the central nervous system, which means peripheral nervous system, that we can classify those nerves based on how they function, which means, are they afferent? That means incoming. Clearly, then those action potentials are relaying sensory information. Or are they efferent, outgoing, carrying the commands to effectors. Those commands can be voluntary or involuntary. So now, just want to make sure that this is in fact recording. It is. I'm going to move down to this picture and then just briefly tell you what you're looking at here. So this picture is probably the most like the one you're about to see later in the document, and one that you have seen in your homework packet as well. Just to orient you, this is the dorsal side, and this is the vertebral side, or sorry, the ventral side, where we would find the vertebrae bodies sticking like this. And on the dorsal side, we would have those spinous processes sticking out. So just to give you some orientation there. In this part right here, we have the dorsal root, and that bulge right there is the dorsal root ganglion. All of these things are itemized up here. So again, letter F up here is showing you a dorsal root ganglion. So right here is another example for letter F. Now we have incoming action potentials, sensory action potentials that come in through the dorsal root, and we have motor outgoing commands that go through the ventral root, which is this small one over here. This is a collection of neuronal cell bodies that we find all along our spinal cord, and those are the sympathetic ganglia of the sympathetic trunk. There is, yet again, we see another pattern. We see an incoming and an outgoing ramus. Now, the incoming and outgoing ramus for getting into and out of the sympathetic trunk are not called afferent or efferent because they are still carrying outgoing commands. Both the white ramus, which is letter L, and the M ramus is the M is pointing to the gray communicating ramus. Those rami are carrying outgoing commands to involuntary effectors. So the white ramus is the indoor, and the outgoing part leaving the sympathetic trunk is the gray. And again, you can see that up here. We have the L being the white ramus and M being the gray ramus communicans. So now we're going to cover the sympathetic nervous system first. And in this paragraph right here, these itemized portions, it's basically telling you where you find these structures of the sympathetic division. So we have the cell bodies of the preganglionic neurons. You should know this by now, are found at levels T1 through L2 in a lateral gray horn that is specially named the intermediolateral cell column, or IMLCC, as I abbreviate it in your homework packets and on your exam. So the preganglionic fiber has the option of going through a white ramus communicans. I'll remind you that the preganglionic neuron is myelinated. The postganglionic neuron is not myelinated. So let's go through one option for preganglionic fibers. And here we have option 1. The preganglionic fiber may synapse in that ganglion. So what does that look like? Here is our preganglionic cell body. It exits through a ventral rootlet, enters a ventral root, travels now in a spinal nerve. That spinal nerve branches into a posterior or anterior primary ramus. So the preganglionic fiber enters the white ramus communicans and can synapse on a postganglionic cell body at that level. So that's option 1. It can stay at that level and enter the sympathetic trunk. It's kind of cool, but slightly annoying. Let's just stick to blue, shall we, and not have the effects. There. All right, now let's move on to item or option 2. And in option 2, the preganglionic fiber can go up or down the trunk. Now, I'll remind you, white communicating rami are only found at levels of T1 through L2. That's the only place where we find them. Those are the entrance into the sympathetic trunk. But clearly, you have involuntary effectors that need to be reached in your face, right? That is clearly superior to T1. So you might have these preganglionic fibers enter in a level where they can enter, but then either need to go higher, say to reach destinations in your face, or lower to items, involuntary effectors that are below L2. Clearly you've got sweat glands in your skin that's in your legs. So being able to go up to higher levels or down is an option. So what would that look like? Let's say for this first example, we're at the level of T1. And if this is T1, then this white communicating ramus is not an option, right? That would be at the level of C7. And there aren't any white communicating rami. So we would have, here's our preganglionic cell body, and we would have the preganglionic fiber going through a ventral root to a spinal nerve for a short time, then it enters an anterior primary ramus, enters a white ramus communicans, and goes up. And it can even keep going higher up to, say, C2 or C3. But it would go to a higher region and then synapse. Now, I could have easily have said that maybe we're at the level of L2. And if I said we were at the level of L2, then we would have had the preganglionic fiber exit through the ventral root, enter a spinal nerve, enter an anterior primary ramus, enter the white ramus communicans, and maybe go down to a lower level like L3 or L4 or even a sacral level. And again, for regions lower than L2, we would not have this white ramus communicans. The entrance into the sympathetic trunk is only found where we find white communicans. And those are only at the levels between T1 and L2. So that's another option. The preganglionic fiber can go up to higher levels, superior levels, or may pass inferiorly to reach lower ganglia. It is important to know that we always have a gray ramus communicans, an exit door for fibers to leave the sympathetic trunk, and we will deal with that when we get to the postganglionic fibers. So now we have another option. Of course, we have another option. The sympathetic division, if you haven't figured it out by now, is a lot more complicated than the parasympathetic division. So in this option now, we're looking at a preganglionic fiber that may pass through the sympathetic trunk ganglion and enter a thoracic or lumbar splenic nerve. Splenic nerves are always preganglionic fibers. That's important that you remember that. I have seen a lot of anatomy textbooks for two-year schools, community colleges, get that wrong. A splenic nerve is a preganglionic fiber that is making a change in course. It's a special option. Okay, so here's what it's basically saying. The preganglionic fiber will synapse in a collateral ganglion. Okay, that's below the diaphragm. And we forget that, yeah, you can have thoracic and lumbar splenic nerves below the diaphragm. T12 goes quite a distance, or is found quite a distance below the level of your diaphragm. So this option is a below diaphragm. And basically, the sympathetic preganglionic fiber, if it could talk to you, would say, hey, I just want to get a little bit closer to those involuntary effectors. I need to go a little bit further than all the other previous two options. So the preganglionic fiber exits through a ventral rootlet to a ventral root to a spinal nerve for a short time before entering an anterior primary ramus, entering through a white ramus communicans. It does not synapse, does not go superior or inferior. Rather, it goes through this option where we have a splenic nerve, and it terminates on a collateral ganglion. So this branch right there would be one of those thoracic or lumbar splenic nerves that is described under option 3. This ganglion is found on major blood vessels. And of course, in anatomy, it seems like there are multiple names for everything, right? That's our joke. So those ganglia are called collateral, or they're also called prevertebral ganglia. And then they can even become more specific for their name, because these collateral ganglia, prevertebral ganglia, are actually found on major blood vessels found in the abdominal cavity, like the celiac trunk, superior mesenteric artery, and inferior mesenteric artery. And those are the three I want you to know. So we have celiac ganglion, superior mesenteric ganglion, and inferior mesenteric ganglion. They are all specific examples of collateral or prevertebral ganglia. All right, so that was option 3. Oh, and of course, being the sympathetic division, we have another option to entertain. And I'll remind you right now, we are still talking about the preganglionic sympathetic fiber. So in this option, we're talking about a preganglionic fiber that's going to pass through the sympathetic chain ganglion and use a splenic nerve, basically, to synapse on cells of the adrenal medulla. So, and the cells in the adrenal medulla are considered to be postganglionic neurons, and that's important that you remember that. Some students say, hey, Kara, you said the autonomic nervous system uses a 2-neuron chain, and yet here we're having a preganglionic fiber synapse on a gland. Yeah, but the adrenal medulla is an extension of the sympathetic division, and the cells that are found there, chromaffin cells, are considered to be the postganglionic neurons. So here's what it's basically going to look like. Again, we're getting to the adrenal medulla, and I apologize if you're seeing my computer screen shake. It's been a problem lately. But it exits through ventral rootlet, enters the ventral root, enters the spinal nerve for a short time before entering an anterior primary ramus, enters a white ramus communicans, enters a splenic nerve, but does not synapse on a collateral ganglion. It basically is going to synapse on the adrenal medulla, which I always draw as a triangle above the kidneys. And that's my pathetic drawing of a kidney with the ureter coming out. So the adrenal medulla is the middle part of the adrenal glands. Now we are going to move to, maybe if I click out, maybe if I remove some of the windows that are open, my computer will calm down. Maybe a little bit, maybe not. It has been a problem for me, but I apologize. If you have your own document in front of you, it's not going to be as shaky. Who knows, maybe you're not even seeing my computer screen shake. So options for postganglionic fibers. Okay, now we're on the postganglionic. And what we're going to do is entertain. First of all, I'm going to draw the preganglionic fiber, entering a ventral root to a spinal nerve to an anterior primary ramus. And let's say it is synapsed at level, but I could also draw it at either a higher level or a lower level, but it's going to the sympathetic trunk ganglia, one fashion or another. So this could be option 1 or option 2, preganglionic fiber at this point. But now we're entertaining the postganglionic fibers. And what they do is they can exit. So here's the cell body of the postganglionic neuron. Its axon is not myelinated, so it goes through the outgoing gray ramus, because that means it's not myelinated. And it could re-enter an anterior primary ramus, or it could have gone out the posterior. And it's going to target effectors in your skin, like the smooth muscle of your erector pili muscles, or it might be, and those, remember, make your hairs stand up on end when you get goosebumps. It could be targeting sweat glands in your skin. It could be targeting smooth muscle in blood vessels in the dermis of your skin. So it's basically going to pretty superficial involuntary effectors, and you have those same effectors on your back. So if we were trying to target them on the back, the postganglionic fiber would go through a dorsal primary ramus. All right, so that's one option for the postganglionic fiber. But here's another option. First, I'm going to draw the preganglionic fiber. And it enters the trunk and synapses on the post. Now this is above the diaphragm. Above the diaphragm. And we're going to try and target, say, involuntary effectors above the diaphragm. Internal involuntary effectors like the heart and the smooth muscles that line the air passageways in your lungs. The postganglionic fiber is not going to exit the sympathetic trunk through a gray ramus. Instead, it's going to exit through a nerve out the back, I call it the back door, and then target that involuntary effector. This is not a splanchnic nerve. It is not. Splanchnic nerves, remember, are only preganglionic fibers. The reason why some students get confused with this picture is because up here, this structure that I used for option 3 in my picture was a splanchnic, but notice that I drew it connected to a collateral ganglion. For the sake of just having a well-drawn picture, notice I have this backdoor option, but it's not going to a collateral, and this is above the diaphragm, so this is not a splanchnic nerve. This is a postganglionic sympathetic fiber that is just breaking out of the sympathetic trunk in a passageway that is not called a gray ramus. So these are basically called cardiac nerves. And even some of them still go to the lungs. So it's just another term so that we don't confuse it with splanchnic. Now here's another option. In this option, the postganglionic fiber is going to be found in the collateral ganglion. So now we're going back to our below diaphragm. Here's our preganglionic fiber going through a ventral rootlet to a ventral root to a spinal nerve for a short time, to an anterior primary ramus, to a white communicating ramus. It does not synapse in the trunk. It enters a splanchnic nerve and synapses on a collateral ganglion. In the collateral ganglion is where we would find our postganglionic neuronal cell body, and the postganglionic fiber would be targeting involuntary effectors in your gut, like trying to reduce gut motility. It would be targeting sphincters and smooth muscle lining your intestines and reducing the muscle tone in the smooth muscle of your intestines. If it's targeting a sphincter, it would increase the muscle tone to close off that body orifice. Basically, if you're running for your life, now's not the time to be saying, "Ooh, I gotta go big potty," right? All digestive processes when you're running for your life are considered unnecessary. So you shut down your gut, basically. Now, we are not going to worry about visceral afferent fibers. That means sensory. So I do not want you to worry about this at all. I am not asking you to draw the pathway of visceral afferents. You should simply know that a visceral afferent fiber is relaying sensory information from involuntary effectors, and their cell bodies would still be found in dorsal root ganglia. That's where we find cell bodies for all sensory afferent fibers. But I am not asking you to draw that pathway. All right, so now we're finally at the parasympathetic division, which is a lot easier. Now, where do we find the preganglionic cell bodies? We find them in nuclei for cranial nerves 3, 7, 9, and 10. So they would be found in the brainstem, basically. There's your cerebellum. Midbrain, medulla, pons, medulla. It's a poorly drawn brain, but you would find them midbrain, pons, medulla, and those are where the cell bodies would be for the preganglionic fibers coming off the cranial nerves 3, 7, 9, and 10, or the preganglionic cell bodies can be found in the sacral spinal cord at levels S2, S3, S4. So they would be found in a lateral gray horn called the sacral lateral gray column, or SLGC as I like to call it. Okay, so here is how, over here where I've drawn the brain, those preganglionic cell bodies are found in the brainstem, and the axons leave through nerves, basically, that are going to travel in your head, down your pharynx and larynx, and we'll address those later on in our homework packet. But what about the sacral equivalents? Of course, they still leave through a ventral root. Oops, let me change my color. Through a ventral root. And now what they're going to do is they're going to enter a pelvic splenic nerve. And remember, splenic means that it's preganglionic. You might be asking, well, what is this? That is a sympathetic ganglion in the sympathetic trunk, and you're seeing right here an exit door, the gray ramus communicans. Notice that there is no white. Then students say, well, what is this? Well, that's just another special nerve, and we are not testing on that. I'm just trying to draw this level of the spinal cord as correctly as I can. So that's the option for the preganglionic parasympathetic. They come off the brainstem, or in the case of the sacral equivalents, they are using a pelvic splenic nerve. Much easier. Parasympathetic is a much simpler division. What about the postganglionic neuron options? Well, it's important that you remember that when we're targeting involuntary effectors below the diaphragm, there's an important anatomical part called the left colic flexure. It's also called the splenic flexure. Let's say I'm trying to increase digestive processes in the stomach or the small intestine. So for all of these structures, small intestine, stomach, and most of the large intestine, ascending colon, transverse, it's going to be actually, oops, here's my pathetic brain again. We're going to have cranial nerve 10, which is a preganglionic fiber, and it's going to synapse. I'm just going to draw it randomly here. So this is cranial nerve 10. It's going to synapse on a postganglionic parasympathetic cell body found in the wall of the involuntary effector called a terminal ganglia. And then this one will terminate On the stomach, we might have another one that terminates on the small intestine, or for parts of the large intestine that are before the left colic flexure, also known as the splenic. So again, these would be in terminal ganglia, in the wall of the involuntary effector. What do I mean by that? Well, we haven't learned about the digestive system yet, but we have learned about the heart. And I could have just as easily drawn cranial nerve 10, having a branch going to a postganglionic cell body that would target the heart to reduce heart rate. And you should remember from your cardiac chapter that the heart has layers. It has endocardium, myocardium, and epicardium. And when I say these terminal ganglia are found in the wall of the involuntary effector, it means in the case of the heart, for example, we would find those terminal ganglia just underneath the endocardium, just superior, if you will, of the myocardium, which is the involuntary portion of the heart, right? That's the cardiac muscle that we're trying to target. So that's what I mean by in the wall of the involuntary effector, and that is also written in here, either near to or in the wall of the organs innervated. Now, what about for the sacral equivalents? Well, as I drew before, exits through a ventral root, enters a pelvic splenic nerve, and we would be using these sacral equivalents to target structures that are found in the pelvic bowl or below this left colic flexure. I'm going to put LFC, left colic flexure. They too would synapse on a postganglionic neuron found in the wall of the involuntary effector. And let's say we're trying to increase gut motility of the descending colon. So that we would have to use a ventral, a sacral equivalent with the preganglionic fiber exiting through a ventral root, going through a pelvic splenic nerve. So the rest of this is just a lot of the same material that I covered in class. I told you you would need to know about the effects of the two divisions for the lungs. You would need to know this for the pupil. You would also need to know the effects for the heart. I did talk about the special case of the adrenal medulla. It's parasympathetic, has no business being there whatsoever. And I also talked about the gut. Okay, that concludes one of our videos for going through the options of the autonomic nervous system. Before I close, though, I'm going to switch screens and I'm going to pull up your homework packet and go over some of the answers that you see there. Now, I'm not going to fill in everything again because most of you have already been emailed your answers. I'm just going to talk through some of the more challenging pathways. This one is going through a knee-jerk reflex. And when we have a knee-jerk reflex arc, a knee-jerk reflex arc is one of the more simple reflex arcs we can think of. It is on the same side, so we say it's ipsilateral. And it is considered to be monosynaptic, even though when we actually draw it, it looks a little false, but that's one of its characteristics. So the first thing we're asked to do is draw a V on a ventral root. Well, this is a ventral root. Okay, so we did that. And now I want to draw the reflex arc. Okay, so here's my sad knee. in your very Simpson style foot there. And the doctor hits your knee. So that's the sensory part with the hammer. And we have the afferent incoming fiber coming up. Its cell body is in the dorsal root ganglion, and it's going to synapse on a somatic motor neuron. Remember, somatic motor neurons, part of our somatic motor nervous system. They target voluntary effectors. So this one, we're going to say a plus, because that sensory neuron is stimulating this somatic motor neuron, exits through ventral root, enters the spinal nerve. And now, where are we going? We want which muscles to contract? Well, if we're getting a knee-jerk reflex, we want to contract the quadriceps. So those are on the ventral side of your leg, correct? So I'm going to draw, oops, change color. So it asks, which muscles are going to contract? Quads. And this is the simple part of why it's called monosynaptic. The sensory neuron coming in has a one-to-one relationship with a somatic motor neuron that is innervating the muscle that you want to contract, monosynaptic. But we know from lecture that if we are stimulating our quads to contract, we need our hamstrings to relax. And there is no neurotransmitter that is released on skeletal muscle to make it relax. In order to make skeletal muscles stop contracting, we learned this in Unit 1, we need a somatic motor neuron to not fire, to not release acetylcholine. So the hamstrings need to relax. What neurotransmitter is released on muscles that contract? Acetylcholine. Is there a neurotransmitter released on hamstrings to make them relax? No. So what happens is this sensory fiber has another terminal bouton that synapses on an interneuron, shown here in black. Neurons can only release one kind of neurotransmitter. So if this sensory neuron is releasing excitatory neurotransmitter on the somatic motor neuron, it's also going to release excitatory neurotransmitter. That's what the plus stands for. Onto this interneuron shown here in black. And then the interneuron can synapse on a somatic motor neuron that would be going to the hamstrings, but that interneuron would be releasing an inhibitory neurotransmitter. And I'm going to put that as a negative sign. And that means that somatic motor neuron cell body that innervates by an axon, the hamstrings, would be hyperpolarized, further away from threshold. And those are terms we should still remember from lecture unit 1. Okay, and if we are told that this is part of the lumbar plexus, L1 through L4, what part should not be there in any portion of this plexus? Well, L3 and L4 are below the level where we would have a white communicating ramus. So it says for any portion of this plexus, so a white communicating ramus would not be there. And this picture is showing you right here a pelvic splenic nerve for the parasympathetic division. Well, that is not there until S2, S3, S4. So that also would not be there. So let me reread the question again very carefully, and I'm going to erase something. The question says, not present for any portion. Okay, so then that means, when I read that more carefully now, for at least a portion of it, yes, the white communicating ramus would be there for L1 through L2. So it says, did not read carefully enough, and this is always a hazard, as we know, for even students. What structure on this picture would not be present in any portion? Well, again, for L1 to L2, the white ramus would be there. So I'm not crossing it out. I'm highlighting it to say, yes, it would be there for at least a portion of it. But the pelvic splenic nerve certainly would not. Okay. Now, here is another set of orders for drawings, and I'm just going to highlight a few of these because I don't want this video to be too long. And we are told we are at the level of T2. So right there, that tells me I am at a level where I could find the sympathetic division. Okay, so that's good. Draw an A in the central canal. I'm not going to do that because it'll make my picture too messy. Draw a B where preganglionic cell bodies would be found. Okay, well, if I'm doing this on the spinal cord, preganglionic cell bodies would be found in the intermedial lateral cell column. Draw an arrow to a dorsal root ganglion. Okay, well, that's the dorsal root ganglion right there. Draw the afferent nerve that detects changes in blood pressure. Make sure you name this nerve. Well, the afferent nerve that is going to detect changes in blood pressure, shown in this picture here for the heart, would be an afferent nerve that has the ability to carry action potentials from those baroreceptors found in the aortic arch. And the only afferent nerve that is going to relay that up to the medulla oblongata is the sensory portion of cranial nerve 10. So it's going up to the brainstem. So that's cranial nerve 10. Make sure you name this nerve and correctly draw its origin. Well, for the sensory part, it's going to come off of those baroreceptors, and it terminates on the medulla oblongata. But then we're told to draw a 2-neuron chain that could speed up heart rate. Well, if I'm speeding up heart rate, then that is the sympathetic division. And it will, preganglionic fiber is going to enter ventral rootlet to a ventral root to a spinal nerve to an anterior primary ramus and enter a white communicating ramus. It is going to terminate in the sympathetic trunk ganglia. Remember, that was one of our special options, and this is an option above the diaphragm. So the heart is above the diaphragm. And that means the postganglionic fiber is going to exit out of the sympathetic trunk, out one of that back door, remember, but it's not going to go to a collateral ganglion. Instead, it's going to terminate on the heart to speed up heart rate by targeting the SA node and AV node, and it will also increase force of contraction. So we actually have some postganglionic fibers that can innervate cells in the ventricles. Which neurotransmitters would be used by each? Well, for sympathetic, it's acetylcholine for the first one, and for the postganglionic neuron, it would be epinephrine. So this is my last example, and then I'm going to post this video for you. And again, if you're seeing my shaking computer screen, you can appreciate why I'm getting so tired with eye strain by the end of an 8-hour day in front of my computer with this online distance learning debacle that we're all facing right now. I've tried to fix it. I think it's time that I need a new computer. It's only 4 years old, but I heavily use it. Okay, now we're at the level of T12. It's important that we take time to read where we are. So we're at T12, and it says, draw the sympathetic outflow from this level to the spinal cord, or from the spinal cord to the stomach. And if we're using sympathetic outflow to target the stomach, we're going to decrease activity, right? We don't, if we're running for our life, we don't want to have digestive issues at that time. So we're below the diaphragm. That's important that you remember. We've got a below the diaphragm example here. I'm going to exit through ventral root to spinal nerve to an anterior primary ramus, enter a white communicating ramus, enter a splenic nerve, lumbar or thoracic, and I'm going to synapse on a collateral ganglion, which I addressed earlier. And the postganglionic fiber will now target the stomach, which is up here. And we're going to reduce gut motility. Now, the neurotransmitters, just so we remember, released from the first one would be ACH, but released from the second one would be epinephrine. Now it says complete the picture by drawing the parasympathetic outflow to this same region. Let's say we're done running for our life. We survived. Now we want to increase gut motility. So if it's parasympathetic, we would increase gut motility. And if we're going to the stomach, this is before that left colic flexure. So we would need to use the preganglionic fiber from cranial nerve 10, coming all the way down through your thoracic to abdominal cavity. So that's cranial nerve 10. In this case now I'm drawing its visceral efferent fiber. It would synapse on a postganglionic neuron found in the wall of the stomach, and it would terminate on the stomach to increase gut motility. What neurotransmitters would be released? Because we're asked that. ACH from the first one, and also ACH from the second. Then over here, what types of fibers would be found in the structure with an X on it? Well, the X got shifted, and I was trying to mark what kind of structures we would find, I'm guessing here, and we would find sympathetic preganglionic fibers. But if it was, and I forget, that sometimes it varies from semester to semester what I asked them to identify, but if it was pointing to this anterior primary ramus, we would find visceral preganglionic fibers. We would also find visceral postganglionic. We would also find sensory afferent fibers. We would also find somatic motor fibers. So we would find every single type of fiber we have learned in this unit in an anterior primary ramus. Okay, well, I think I think that's enough for right now. Goodness knows I've made enough videos to abuse you with, but this is a challenging unit, and I'd rather give you more for practice than less, and I hope you appreciate that as well.